Hi everyone, this is Shalu Kumar again from OSCE Training Cambridge. Welcome back to my YouTube channel and I hope you had a great Christmas and New Year celebration. So back to the new year. So happy new year, and this is our first video in the new year. So let's get started. So I'm back with another video for you. So if you like my videos, do not forget to like and subscribe. So today's video is really important one. It's about the use of protective personal equipment, PPE, for your NMC OSCE exam, because there has been a lot of confusion. When should I use it? Do I need to use it? And how to discard it. So I am hopefully going to answer all those questions about the PPE, the use of PPE in your NMC OSCE exam. So let's have a look. So the general question you asked me is on the slide. So do I need to use it? So we'll answer that one. When to use it? So first thing is, do I really need to use PPE in my stations? We will have a look. Second question is when to use it, and if I do need to use it, which stations do I need to use it for? And the third question I always get asked is, how do I discard it safely? Okay, so those are the three things which we're going to go through in today's video, and we will look at different stations one by one. And we will go through when to use PPE and how to discard it. Okay, so let's have a look. So the first question on the first slide, next slide, do I need to use it? So to answer that one for you, it depends on the station. Okay, so for the API stations, which are your assessment, planning is written station anyway, and AP assessment, P planning, which is written station, I is implementation, and E is evaluation. So evaluation is a verbal station. So definitely not for planning and evaluation, because one is written, one is verbal handover. So then that leaves to assessment and implementation. Do you need to use the PPE, your gloves and apron? No, you really don't need to use it unless your examiner specifically asks you to, because they were asking when we had the COVID and all that stuff, but they're not asking you to do it anymore. So you don't need to use PPE in assessment and implementation station, which is your drug station. Just clean your hands at the right points in the station. Okay, so making sure that you clean your hands regularly when you need to clean them as per World Health Organization 5 moments of hand hygiene, but you really don't need to put any PPE on unless your examiner is specifically asking you, which they will not. Okay, so that's the answer to the API station. So you definitely don't need to put any gloves or apron on for your assessment and implementation station. Planning is written anyway, and evaluation is verbal handover, so definitely not. Okay, so that's the one thing to remember there, but do the hand hygiene when you need to do it. So going on to next slide then. So when to use it? If it's not for API, so when do we use the PPE in our NMC OSCE exam? It is mainly for the clinical skills. Okay, so it's the clinical skills which are not written. Okay, so there are lots of written skills now, like bowel care, oral care, fluid balance, pressure area assessment, malnutrition, the nutritional assessment station. So they're written stations. So of course you're not going to wear any PPE for the written station, not needed. Now, rest of the station, it depends on the skill. So the use of personal protective equipment should be reflective of real practice in clinical areas. So if we use PPE for the clinical skill in the real clinical area, then of course we should be using it for OSCE as well. And your marking criteria does give you guidance on when to use and which PPE to use. So it's actually check your marking criteria. All clinical skills, again, even if they are not written skills, they are hands-on skill. Again, they don't all need PPE. Okay, so let's have a look on the next slide. Now this is, I'm gonna make your life easier here and just tell you which skill you need to use it, which skill you don't need to use it, going through this list of skills from the NMC. So I've just copied this slide from the NMC obviously test center website, which skills are at present on the list in the syllabus, and then what we're going to look through is do we use PPE in that particular skill or not. Okay, so that hopefully will make it very clear for you if you need to use it or not need to use it in that skill. So the first one on list here is administration of inhaled medication. You don't need to use the gloves and apron to do the actual skill to give the inhaler, but you do need to use the gloves when you clean the spacer device afterwards. Okay, so what I'm trying to say is most of the skills you don't need it. You can go ahead and do the inhaler with just clean hands, give the inhaler, but after giving, because it's been in patient mouth, so you can't like clean it without gloves on the spacer. So then you need to, at the end of the station, once you've given the inhaler, you put the spacer on the tray or trolley, and then you put your gloves on, and then you clean the spacer with a big cleanel wipe using from clean to dirty part, and that's when you need gloves on, of course, because you can't touch something is in somebody's mouth, you can't touch it without gloves. So then you do need to put gloves on. So no apron needed, but gloves need to be on. So that's the administration of inhaled medication. Moving on to administration of suppository. Of course, you definitely need to put your gloves and apron on to give suppository. So that's a clear one. Moving on to blood glucose monitoring. Yes, you do need to put gloves and apron on before you start pricking the patient mannequin's finger. So yes, definitely need that. Next one is bowel assessment. Of course, it's a written station, so you definitely do not need any apron and gloves in that one. Next one after that is catheter specimen of urine. Of course, this is the biggest fail in this station actually. If you maneuver the catheter or the tubing without any gloves and apron on, even when you're applying the clamp, make sure you have your gloves and apron on to apply the clamp and also to take the sample. Okay, so yeah, definitely you need to put your gloves and apron on. Next one is fine bore nasogastric tube. Of course, insertion of nasogastric tube, you will need gloves and apron on to do that. Yes. Next one is fluid balance. Is your written station, so obviously not, so you don't need anything for that. And next one after that is intramuscular injection. Now interestingly, it was part of your marking criteria to wear gloves and apron for intramuscular injection, but on the last update from NMC, they have said that you don't need to use gloves and apron to give IM injection. So that has been taken out of the marking criteria, that you do not need to wear gloves and apron to give IM injection. So that has been the recent change in last few months. Next one is IV flush and VIP score. Of course, you do need gloves and apron to do this procedure because it needs to be, flushing has to be done with aseptic non-touch technique. So you definitely need gloves and apron to flush the cannula. After that is the nasopharyngeal suctioning. Of course, you do need gloves, apron, also mask and eye goggles for this procedure. So you need all full set of PPE for this one. To do your nasopharyngeal suctioning. Next one is nutritional assessment. So this is a written station. So of course you work with a scenario. So you do not need any gloves and apron for that one. And moving on to next one is oral care plan. Again, it's a written station. So of course not. You will not be wearing any gloves and apron. Next one after that is oxygen therapy. Now, in clinical practice, we don't wear a gloves and apron to start somebody's oxygen. So it's not needed. It's not part of your marking criteria. So definitely you don't need to wear gloves and apron. Just clean hands will do before you start connecting the oxygen and start applying it to your patient. Make sure you have clean hands. But no, you don't need to wear gloves and apron for that one. Moving on to pain assessment. Again, not. Just clean hands will do, so you don't really need gloves and apron for that one either, because it's more verbally assessing your patient pain by asking questions according to PQRST technique. So no. Next one is peak exploratory flow rate. Yes, for the peak flow, it wasn't part of the marking criteria, but it is now that you actually carry out the peak flow on your patient, peak flow readings with gloves and apron on. So yes, you do need to wear it for that. Pressure area assessment next, no, because it's a written station. Next one is removal of urinary catheter. Of course, anytime you deal with body fluids or manipulate any catheters or tubings, yeah, definitely you need your gloves and apron on, because that's the biggest fail in this station. Now wearing gloves and apron will be critical fail. Subcutaneous injection, yes, you do, is still part of the marking criteria, even though it's not for IM, but it is for subcut, so you do need to wear your gloves and apron for giving subcut injection. Next one is MSU and urinalysis. Of course, anything to when you're dealing with body fluids, yes, definitely you need your, when you do the urinalysis part, not to give instructions to the patient how to collect for MSU, midstream specimen of urine. At that stage, you don't need it, but when you do the urinalysis part of the station, you definitely need to have your gloves and apron on. Last one is wound assessment and aseptic non-touch technique that goes within the name. It is a aseptic non-touch technique. Yes, you do need your gloves and apron on for that station, which is 20-minute combined for wound assessment and aseptic non-touch technique. So you definitely need gloves and apron for that one. So I hope that makes it quite clear in your mind where you need and where you don't need gloves and apron on. So that's fine. Now, so you will say, do I need to wear it for wound assessment in the beginning and then do it that way? For wound assessment, yes, you can, but if you were not thinking to touch the wound because it's normally just a picture, then you don't need to. But if you put gloves and apron on for wound assessment, they will not fail you, so that's absolutely fine. And aseptic non-touch technique, of course you need a new apron, and then you will do your dressing with sterile pair of gloves anyway, so yes, you will need gloves for that and apron for that. So that's hopefully makes it quite clear for you what you need to do in different station. So next slide, how do I discard it safely? So any PPE which has been used needs to go into the clinical waste bin, and make sure you clean your hands afterwards, because if you do not clean your hands after disposing your PPE, that could be a critical fail because it's infection control. So make sure you clean your hands immediately after disposing your personal protective equipment. I hope this makes it all clear for you now, and you enjoyed the video and you got your answers which you've been asking me on the YouTube. So if you would like to know more about our training, then email us on oskinurstraining@outlook.com. You can visit on oskinurstraining.com as well. That's our website. We provide both online and face-to-face training. I will soon be back with another video for you. So if you haven't already liked and subscribed, please subscribe now, and I will see you very soon. Bye for now.